Hello, I am Dina Guda and I'm one of the Spanish interpreters here at Nebraska Medicine. As part of our commitment to extraordinary patient care, and as required by the American Disabilities Act, we provide on-demand interpretive services for any patient who may need it. Under the law, we must ensure that the patient and their caregivers receive medical information in their own language. The service is offered at no charge to the patient. Spanish is the most spoken second language amongst the minorities in Omaha. To better serve these patients, we have at least one interpreter present on campus Monday to Friday from 6 a.m. to 10 p.m. and from 8 a.m. to 4:30 p.m. on weekends. There is also an interpreter on call after hours and on holidays. To reach an interpreter, call our office for on-demand phone assistance 8 a.m. to 5:30 p.m. Monday through Friday, otherwise page for assistance. We also provide on-demand video assistance, also known as VRI. We recommend you use the VRI when it's necessary to perform a demonstration or in situations where it would be helpful for the interpreter to see inside the patient's room. In one chart, you'll find a sticky note on the Summary tab of patients with limited English proficiency that details how to reach an interpreter on demand. Our interpreters also translate the after-visit summaries for Spanish-speaking patients who are being discharged from the hospital. If you have a Spanish-speaking patient, you can request the after-visit summary to be translated. You can do that through the Volt phone. Also keep in mind, sometimes you'll have a patient who speaks English, but the caregiver would need the discharge instructions translated. For patients who are deaf, there are 8 sign language interpreters available. Clinics must submit a request for a sign language interpreter in advance. If an interpreter is not available, the clinic staff must inform the patient and give them the option to use our video services or reschedule their appointment. For hospitalized deaf patients, we must have a computer with a video capability at the bedside at all times for an on-demand video sign language interpreter. We also offer voice amplification devices for patients who are hard of hearing. This device allows the patient to amplify the volume control on a device that looks similar to a Walkman. It allows the patient to hear the clinical staff without the need for staff to raise their voices. Contact our department if you need one of these devices. Nebraska Medicine also has a contract with Certified Languages International Services for all languages. This is a great resource when you're caring for a patient who does not speak English or Spanish, or when a Spanish interpreter is not available. You can find CLI's contact information on the Now page under Interpretive Services. If a patient prefers to have a family member or a friend interpret for them, the patient must sign a waiver. The waiver form must be read aloud to the patient in their own language, either by one of the interpreters or by one from Certified Language International. Please remember, a patient's family member or friend cannot read the waiver form to the patient. Be sure to document the name of the interpreter, their ID number, and their organization on the waiver form. That is a requirement. Please provide a copy of the waiver to the patient. A waiver form can be signed for a series of appointments as long as the person interpreting for the patient is the same person and is 19 years or older. I hope this information has been helpful. If you have any questions, please call us.